A good example of chronic inflammation is the inflammation that kicks off atherosclerosis. Hi guys! We often hear people speak about inflammation. So what exactly is inflammation? Inflammation refers to our body's process of fighting against things that harm it, like infections, injuries, and toxins, in an attempt to heal itself. Simply put, inflammation is the body's natural response to protect itself against harm. There are two types of inflammation: acute and chronic. Acute inflammation is something most of us are familiar with. This is the type of inflammation that happens when you catch an infection, cut your finger, or even following an injury to your ankle. In these cases, our defense mechanism, which is our immune system, dispatches an army of white blood cells to surround and protect the area and facilitate healing. And this is why we often notice the common signs of inflammation, which is pain, redness, swelling, heat, and also loss of function. On the other hand, chronic inflammation occurs as a result of constant exposure to other unwanted substances in the body, such as toxins from cigarette smoke or an excess of fat cells. Chronic inflammation is also referred to as slow, long-term inflammation lasting for longer periods ranging from several months to years. The extent and effects of chronic inflammation can vary depending on the cause of the injury and the ability of the body to repair and overcome the damage. When we live with chronic inflammation, our body's inflammatory response will eventually damage healthy cells, tissues, and organs. Over time, this can lead to DNA damage, tissue death, and internal scarring. A good example of chronic inflammation is the inflammation that kicks off atherosclerosis. Atherosclerosis is the buildup of fatty cholesterol-rich plaques. Our body perceives this plaque as foreign and abnormal, so the natural response will be to wall off the plaque from the flowing blood. But if that wall breaks down, the plaque may rupture. The contents then circulates with blood, forming a clot that blocks blood flow. These clots are responsible for the majority of heart attacks and most strokes. Chronic inflammation is also linked to the development of other diseases such as cancer, obesity, type 2 diabetes, rheumatoid arthritis, cognitive decline, as well as dementia. Without us realizing, our lifestyle can either promote or reduce inflammation. Certain food that we eat, such as refined foods, fried foods, and processed meats, tend to increase inflammation. On the other hand, there is a variety of foods that have anti-inflammatory properties, such as leafy greens, fruits, and nuts. Besides that, studies have revealed that physical activity can also calm inflammation. A single 20-minute session of moderate intensity exercise reduces inflammation in the body by activating the brain and sympathetic nervous system. Now I believe we have more reasons to exercise, right? Did you also know that lack of sleep and stress can also promote inflammation? Even one night of insufficient sleep is enough to activate pro-inflammatory processes in the body. Similarly, both acute and chronic stress is associated with increased inflammatory activity. So I hope today's video has given you some insights about inflammation. The point I would like to emphasize here is our lifestyle choices, which is within our control, really do impact the outcome of our health. So let's start making a wise choice today. Hey everyone! If you like today's video, feel free to like and subscribe to my channel so you will not miss my weekly videos where I shall be empowering you to lead a healthy life. You can also follow me on my Facebook or Insta to get daily health tips and recommend to your loved ones as well. Meanwhile, if you have any questions or feedback, or even any topics that you would like me to discuss, feel free to type in the comment box. Thank you for watching.